My name is Brian Treese. I have the honor of serving as president and CEO of the Findlay-Hancock County Community Foundation. On behalf of our board, staff, and volunteers, I want to welcome you tonight. Thank you for joining us to discuss one of our community's most pressing needs, childcare. In 2017, the Community Foundation hosted our first round of community conversations to help ensure that our funding aligned as closely as possible with the needs of Hancock County. As a result of that, childcare rose to the top of that priority list. In 2020, when I assumed the role of president of the foundation, I went on a listening tour to both introduce myself and hear about the needs from your perspective. Childcare was one of those top priorities yet again. In 2022, our second round of community conversations occurred, and you guessed it, childcare was again near the top of the list. Right now in 2026, we're compiling the data from a third round of conversations, and it is very safe to say that childcare will once again be a priority for the foundation moving forward. In June, we released the State of Work and Play report, which features childcare as one of the topics. This report provides an account of the current state of work and play in several supporting fields, serving as a roadmap for change for our community. The report combines the foundation's knowledge and understanding of Hancock County nonprofits and system work with the desire to fulfill the foundation's mission to improve the quality of life for all in the community. The foundation has been supporting childcare initiatives in our community for decades, recognizing very early on that access to quality childcare is essential for families and for Hancock County's workforce. That's a significant investment in the childcare system. We also share childcare needs with our fund holders to educate and connect them with nonprofits and partners doing this critical work, including the Hancock County Child Care Collaborative. Systems work is complex. It requires significant resources, it takes many partners, and it doesn't happen overnight. Many of the partners involved in this system are here with us tonight to help us collectively understand the inner workings, build understanding, and unite around a pathway forward. An example of the child care system coming together is the TriShare program, which you can find more information about on the back of the handouts at the back of the room. This program supports lower income families who do not qualify for publicly funded child care subsidies. It shares the cost of child care between families, businesses, and a local fund. Joining us tonight to talk about our local child care system are Randy Galbraith from Hancock County Job and Family Services, Carrie Redmond from Findlay Family YMCA, Kathy Schroll from the Village of Macomb, Brittany Bills Darby from Ohio Logistics, and Christina Mern from the City of Findlay. We also have a featured guest from the Ohio Department of Children and Youth, Joel Potts, who serves as the Chief Government and External Affairs Officer. Before we get to our speaker and our panel, I want to go over some of Hancock County's child care data as it stands today. In 2023, the Hancock County Child Care Collaborative began assembling a comprehensive picture of child care in our community, drawing on local sources, local surveys, provider data, state reports, and regional workforce trends. The findings reveal significant challenges for families, employers, and providers alike. You can read more on the handouts that we'll provide later, but here are some of the key points. First, for every one child care spot in Hancock County, there are up to 10 children on a waiting list. In 4 years, Ohio's child care workforce dropped by more than 1/3. It is estimated that to meet the local need and have just a little space for community growth, we need 1,000 more slots for childcare in Hancock County. The average cost of childcare for one child for 1 year in Hancock County is around $10,000. for one child for 1 year. I can see those with young people in the audience shaking their heads enthusiastically. About 1/3 of local children in our community don't have access to publicly funded childcare. This is just a snapshot of the current state of childcare in Hancock County. I would now like to invite Joel Potts, Chief Government and External Affairs Officer, to give us a statewide perspective. Joel.
Thank you. Thank you. As you said, my name is Joel Potts. I'm with the Department of Children and Youth. Many of you may not have heard of the department. It is new. It was created a couple of years ago in the state budget. I used to say that it is an agency that the governor wanted to have full of people who wake up every day, spend their waking hours, and go to bed each night thinking of kids. And then I realized that may not sound the way that I wanted to say or wanted to come across. But we are focused on children and looking at how we can do collaborations, how we can have multiple programs working together on the same goals. There are three primary areas that we are focused on. One of those is reducing the infant mortality. Ohio continues to have one of the highest infant mortality rates in the United States. We can do better. We are seeing significant changes. In fact, the governor just announced yesterday we have seen the lowest infant mortality rate in the state of Ohio in the past 20 years. Great step in the right direction, many, many more steps that need to come. Second area is facing, and this impacts your communities as well, and that's reducing the number of children that are in our foster care system. We don't want to just reduce the number of kids in the system, we want to reduce the need for them to be in the system. Doing more preventative measures, working with Randy and his team and folks to come up with ways to address those needs before they become a crisis. The third area is childcare. This is an issue that is becoming a bigger and bigger challenge and something that we all need to be working on and focusing on. And we focus heavily on early learning. When we talk about childcare, we often talk about a two-generation approach. We want to look at it from not just the perspective of the needs, the immediate needs of the families, the immediate needs of the employers, the immediate needs of the consumers and community. And Brian did a great job of outlining what you're facing here in this county. It is going to take a community approach. It is not going to take one more program, or just one more dollar. It's going to take a lot of programs. It's going to take a lot of dollars. It's going to take a lot of attention. It's going to take a lot of different ways to do this type of thing. But when we look at childcare, we really want to deal with a two-generation approach. Because not only do we want to make sure that we have childcare so that families have a safe, reliable place for their child to be, and that the employers know that their employees aren't spending their time worried about where their kids are. We also want to take advantage of the opportunities to provide quality education and to work with these students. And one of the ways that we are doing that is by looking at the KRA. Now, I'm going to be honest, when I started the department a couple years ago, I didn't know how to spell KRA, let alone knowing what KRA actually is. It's a Kindergarten Readiness Assessment. It is a tool that is used in Ohio that kindergarten teachers assess children at the beginning of the school year to determine whether or not they are coming equipped, ready to learn, to meet that basic curriculum. We have seen, as the rest of the country, we have seen significant decrease in the number of children entering school ready to learn. We have spent a lot of time. How many child care providers are in the room? God bless you. The work that you have done and continue to do is absolutely phenomenal. It is making a huge difference and a huge impact. The KRA is one of those ways that helps us not just to measure, but also shows us a way to tell the elected officials and show the elected officials that their investments are paying off. Yesterday it was announced that the KRA scores for this year, for this group of 5-year-olds entering kindergarten, are the highest in the state's history. They increased by over 8% last year. We still have a long way to go, but they are higher. Everybody's talking about, it's never been this bad. It's worse since COVID. We are seeing numbers that are better than when we entered the COVID year. So the KRA tells us several things, but one of those most important, we know that when kids enter school ready to learn, it is going to stay with them throughout their academic career. We know that kids who demonstrate on the KRA are scoring 7 times higher in their science scores, 5 times higher in their English proficiency scores by the time they reach the 3rd grade. Not percent, 7 times higher and 5 times higher in those things. Those are things that are really measurable. And one of those focuses is by utilizing our child care program to, again, look at that 2-generation approach. Children that are utilizing our quality child care systems are 4 or 5 times more likely to enter school ready to learn. That's showing how important this investment is, and it's making a massive difference. So thanks to all of you as providers that are here for the work that you're doing, because it really is making a difference. It's making a difference to the parents, it's making a difference to your community, it's making a difference to those kids, and we really need to do that. We also know that when kids enter school ready to learn, they will be less likely to drop out, they will be less likely to be teen parents, they will be more likely to graduate and go on to college, they will have increased earnings in their lifetime. So investing in childcare and that 2-generation approach makes a huge difference. But we know how important. Brian, you did a great job, and I know this panel will do far better than I could do to talk about the types of things that you are doing and need to be doing. But I'll tell you, I've been blessed in a lot of ways in my life, but one of those was early in my career. I was able to travel all around the United States working on public assistance programs, welfare to work programs. I actually went as far away as New Zealand and worked with their government for a few weeks to help them develop their programs. And through those travels, I discovered 2 things that are absolutes. These are 2 things that have to happen, that I guarantee if you don't address both, you won't be successful. Addressing both will not guarantee success, but not addressing both, I have not seen programs that are able to come across that. And I will tell you the pride that I have of Hancock County. I've been here for multiple child care experiences. I've worked with Randy and the Job and Family Service agencies. I've seen the type of collaborations that you have. Very few communities could put a panel together like this, where you have government, community leaders, elected officials, you have different folks coming together. You have to have these 2 things. The first is you've got to have a champion. It doesn't matter what we say in Columbus. It doesn't matter what they say in Washington, D.C. If you don't have people who are really willing to champion this cause, it won't be successful. And the other issue is turf. We have got to eliminate turf. You know, if you're a family and you need child care, you don't care whether it's government funded or not government funded, whether it's a private or public, you need reliable child care. Get rid of the turf. Hancock County is leading the way in the state to do this. I have been here, I have seen it, and I was very, very honored when Jennifer asked if I would be willing to come and speak for a few minutes today. And the Child Care Collaborative is something that we need to replicate all around the state. I wish you the best of luck to continue to do these types of things, and we will continue to work with you at the Department of Children and Youth. But thank you for those efforts. By the numbers, you know, we can paint a rosy picture. We're headed in the right direction. We can paint a negative picture. The truth is the need is so great that we need to just make sure that we are collectively talking about it. One of the groups that has been so phenomenal to work with in the child care field for my first couple years of the Department of Children and Youth is the Chamber of Commerce. Local chambers, state chambers, national chambers have been looking at these issues, and they have really been stepping up. They've been working with our elected officials to talk about how important this is for economic development. The recent study by the National Chamber of Commerce showed last April that in Ohio we are losing over $5 billion a year in productivity in the state of Ohio because of lack of adequate child care, which results in a loss of over $1 billion in tax revenue. Our child care program is $1 billion. If we could get the proper child care, we could get that productivity up. We could we could double the amount of money going into the child care program, and nothing would change except more people are working, more kids are entering school ready to learn, more businesses are thriving, more communities are strengthened. You know, so we need to be looking at this collectively, and I really am appreciative, you know, of that work. At any point in time, there are roughly 100,000 children in Ohio's publicly funded child care system, and about 116,000 kids are served each year. There are 5,200 child care facilities around the state, and of those, about 4,500 are licensed for publicly funded child care. When we talk about child care, we talk about the parents, we talk about the kids, we also need to be talking about the business community. and how important it is. We know that when employees are struggling with childcare, it's going to impact their morale, it's going to impact their attendance, it's going to impact that business community. You're going to see lower productivity. You know, study after study after study shows that, but you as employers know it. You live it, you experience it, you see it, that you're going to see increased turnover, and that results in increased replacement costs. It is estimated that for every employee that you have to replace, it's going to cost you about a third of an annual salary to be able to do that. So if you have a $45,000 job, it's going to cost you about $15,000 to bring them in, retrain them, retool, and do everything that you need to do in that particular area. Thank you, as you were showing just the cost, the average cost of childcare. So in Ohio, the average cost of childcare, so this is average, it could be much higher. It is for a family with 2 kids, about $22,000 a year. As you were saying, for kids in general, it's $10,000. Infants, it's actually $11,000. I have an employee who's spending over $18,000 a year for childcare. You know, the average cost of tuition in the state of Ohio is $13,000. It is costing parents as much to send their kids to childcare as it will cost them to send their children to college 18 years later. You can get a college loan, but there are no loans for childcare. You know, that is something that you're going to have to come up with and figure that out. And we know that a 2-parent income are saying that they are spending about 10% of their income is going to childcare. Single-parent households are spending on average about 39% of their income. It is the largest cost. It is a larger cost than mortgage, car payments, all of those sorts of things. The first $11, it's estimated for a family with 2 kids in childcare, first $11 earned in that household are going to go to childcare. So before they pay for transportation, before they pay for lunch, before they pay for parking if they need that, before they pay for anything else, that first $11 is going to go to childcare. So we know how important it is to address those types of things. We continue to struggle and work to increase the eligibility thresholds for publicly funded childcare. We have incrementally seen growth. The governor has been highly supportive of these efforts. We have seen movement, but we still continue to lag behind the rest of the United States. We're one of the lowest thresholds for eligibility to get publicly funded childcare, which means you have to seek other things. We've created new programs. We've created the Child Care Choice Voucher Program for those who are ineligible for public assistance to be able to take those jobs and take that raise. You know, you've all talked about, you've experienced where families have to struggle. Do they take the raise? Do they take a better paying job? If it's ultimately going to result in less dollars coming in to the household because of what they have to invest in the child care program. We have increased provider rates 6 times in the last 7 years, but we still continue to be one of the lower reimbursement states in the United States. We need to continue to look at ways to stabilize that workforce in the child care arena, and that's one of the areas that we've got to address. And we also are developing opportunities for employers to come up with things to do. There are 2 programs that are out there right now. One of them is a early care and education business partnership or a public-private partnership. There are 6 of these in the state. We're very hopeful for the 7th in the very, very, very near future right here that puts some resources for businesses to come up with local solutions, with local ideas of ways that you can address needs in your business community. We have, as I said, 6 of those around the state with 1 more pending in about 10 counties that are doing it. We also have the Child Care Cred program, which is the Tri-Share model. Tri-Share is very popular in several other states. It's something that our legislature has been very interested in seeing us invest in. They put funding in the state budget that is currently out there. 40% of the funding, and this is by statute, it allows employers to decide whether or not they want to do this. Employers would have the flexibility in deciding which employees it would be for. You could use it as a retention strategy. You could use it as a recruitment strategy. You could identify maybe positions that are hard to attract employees. Maybe it's second shift. Maybe it's your low wage jobs that just keep turning over. It would the employer would pay 40% of the child care costs. The employee would pay 40% of their child care costs. And the state would pick up 20% of the child care costs to be able to do that. Here's where it gets weird, and this is where for employers, I think it is so frustrating dealing with government. If you remember nothing else about what I say here, understand here's one of the challenges when it comes to working with government programs. It doesn't matter in many of our programs how great the need is if you do not meet the eligibility thresholds. We're an eligibility-based system providing billions of dollars in services to Ohioans in need. But if you don't meet the eligibility threshold, you often can't get those services. Those eligibility thresholds are usually built around a budget. As business leaders, you know you have a job, you know how much you can use for mortgage, how much of this can go towards salary costs, and so on and so forth. Government programs would say, wait, they get specific budget. Our responsibility is to spend all that money, but not one penny more. So they set up eligibility thresholds, but that makes it really tough on employers. You know, I could talk about 100% of poverty for this, 134% of poverty for that, 200% of poverty. We talk about that all the time, right? You hear these poverty levels. On a show of hands, how many people here know what level of poverty you currently live at? Because you deal in a world that has poverty thresholds. You know, we talk about it like it's the norm. We also have a difference for a lot of our programs that work with lower wage jobs. Entry-level jobs are generally hourly and not salary. Hourly employees generally will have fluctuating incomes. You know, the weather could affect this. A sick child can affect whether or not you're going to get paid this week. When you talk to folks and you ask somebody who is salaried, how much money do you make? And they'll say, well, I make $56,000 a year. Ask an hourly employee how much they make, and what are they going to tell you? I make $14.60 an hour. Well, how much is that a year? How the heck would I know? And so we require them to bring in 2 of the most recent pay stubs. We annualize it, we average it out, we do those types of things. But it is a real challenge. So when I talk about being an eligibility-based system versus a needs-based system, I use the example of going into a job and family service agency. You can go in there, you could recently have lost your job and say, look, I don't know what I'm going to do. I don't know how I'm going to feed my family. And the agency will help, and they'll provide you an application, and they'll help you get through that process. And you may get a notice here within a couple of days that says, hey, congratulations, you're as desperate as you told us you were. You're eligible for these programs, and we can help you. You could leave the agency, go to a food bank or a soup kitchen. You can go to a faith-based organization. You can go to United Way and say, I don't know what I'm going to do. I don't know how I'm going to feed my family. And they would say, here, let me give you some food. Because they are often need-based, not eligibility-based. It is a simple nuance, but it is a huge impacting factor that really intimidates folks. So we are looking at utilizing the Childcare Cred program to find ways that we can work together to help individuals get childcare they need and to be productive and to be involved in the employment community. When we looked at Childcare Cred, I think it's been interesting. It is, right now it is a 1-year program. We are working with the legislature. We are hoping, and I fully expect it to get extended for another year. I've had huge interest all around the state from the business community saying, yeah, we'd like to see this. We want to see what those models can do. One of the areas that I think has been really telling is we've had 141 applications from employers thus far. 80 have been approved, 44 have been denied so far, and then we have others that are pending. The denials are, for the most part, good news, because the reason they are denied is they are eligible for other child care programs, which means the employer doesn't have to pay any additional resources to get that person into child care. The employee doesn't have to pay anything additional to get them into child care. We're hooking them up with the proper programs. One of those things, again, I've learned by traveling around the country, the messenger matters. People often don't think that they are eligible. They don't know that they're eligible for these type of programs, or they view them as welfare programs. And these are work support programs. And the Childcare Cred program is designed around not just supporting jobs, but supporting careers, to help people who are moving up that economic scale, to help them make those changes. And that helps them make a difference. So the messenger matters. When the employer is helping them, they see it as a work support more than they're going to see it as a public assistance benefit. So with that, you're going to learn a lot more by talking to this panel. But thank you for including me To the collaborative, really great work. You are doing incredible job. It is great leadership. It's great to see a panel with so many distinguished individuals who are coming together to address this really important issue. It is going to strengthen this community in ways that can't even start to describe, and I'm sure you've already seen results and will continue to see those. So thank you very much. I appreciate your including me.
Thank you so very much. We are now going to discuss in further detail the current state, solutions, and barriers with our panelists. A reminder to everyone here that our priority tonight is civil discourse and a safe space for discussion. Have to give those reminders. Out of a respect for our panelists, guests, and those who will be watching the recorded video of tonight's events, we ask that you write any questions on the cards that were at your seats. In a little bit, we will have you submit those. I'll read them aloud so we're sure to capture every question as written. And then, time permitting, we will get to as many questions as possible. Because the event is being professionally recorded, both audio and video, we ask that no other recording be done this evening. I remind our panelists to give brief answers to these introductory questions so we have as much time as possible for audience questions. We will start with Randy Galbraith from Hancock County Job and Family Services. A few quick questions to get started. First, what obstacles do you see locally and at the state level to expanding childcare and making it more affordable?
First obstacle is the microphone. I think you're going to ask me another question about policy here in a minute, and I don't know how to divorce the obstacles from the policy. Joel's already hit on a lot of data concerning childcare. We're spending $1 billion a year on childcare. We're serving 115,000 kids and 15,000 kids with $1 billion. It seems like $1 billion would be enough to provide all the childcare we need. But the policies that I have seen over the last 22 years of my career for childcare have been a march toward the early childhood education, as Joel has announced. And the problem I see with that is we used to have, back in the day, I'm old, we used to have a tremendous number of small providers of childcare in every county in Ohio. And since the Kasich administration, I'll use that as the benchmark of moving toward early childhood education or kindergarten readiness, those small providers, what we call the type A and the type B, simply cannot stay in business due to the policies that we have in terms of what the facility must be, what curriculum that has to be provided for the children, the staff they have to have on hand. And under the Kasich administration, we had the Step Up to Quality initiative that occurred, at least I believe that was the governor at the time. And at the time, those levels of quality that daycare providers had to hit were set to be mandatory. That's since been rolled back. But that top level of quality would require a certain number of amount of medical training, almost a nurse, to be at a center, certain number of people that are required to be teachers at a center. And as you start to pile on these regulations, you start to drive up costs. Not only do you drive up costs, you drive down the number of people that might be eligible to work in that facility. And you create a crisis, an HR crisis, as well as a cost crisis. So what's your next question?
Building off of that, and I'll play with the microphone while you answer to see if we can get that working. What policies are helpful or hurtful to the expansion of childcare?
I think I covered what's hurtful. I think we're going to have to come together with policy and figure out how we can best keep kids safe and keep kids educated, while at the same time making sure that the people who provide the child care can actually stay in business doing so. It's my observation right now that the people that are successful, or the entities that are successful at being child care providers, are nonprofits that do something else that have a center attached to them, whether it be a church or the YMCA or another entity. We've got a got a community action commission in here that's got Head Start, and I don't think they could survive if they just tried to do Head Start alone. And I think it's kind of the same way with providers. And that's why you're seeing the Type A and the Type B and the small providers fall away. I think the other thing is, a month, in December, I wouldn't have said this, but I think we're going to have to figure out policies that the taxpayer can swallow after the whole Minnesota debacle that came out. So I will tell you that I have sent a fraud investigator out to everyone here in Hancock County that provides childcare that's not a center, because DCY monitors those centers. We don't have any problems in Hancock County. The kids that are at the centers are open. But, I had to do that because within an hour of that story breaking and me already calling a fraud investigator, the commissioners are on the phone to me saying, have you seen this story in the paper? Because it's true. You're a taxpayer. You're spending $1 billion a year on childcare. You want to make sure that you're actually receiving your money's worth from the providers. And that's going to be the real trick. How do we provide policies to childcare providers that will allow them to stay in business and at the same time ensure the taxpayer that they're not being defrauded? I saw 30 seconds on.
Final question for you at this part. Why is childcare so important?
This is probably the number one question. Why is it important? Because Joel and I talked last week and he pointed this out and it stuck with me. If you're young and healthy, you might not need health insurance, but if you need to go to work and you have kids, you need childcare. You may be able to share a car, but you can't share childcare. If someone needs to go to work, and that's most people I know, and they have children and they're not school age, they have to have some kind of childcare. And the knock-on effect from that is not just it being able to go to work. What we haven't discussed is that for the last 50 years, whether it's written or not, it's the policy of this nation to have two-parent households that are working. And if you knock 50% of the workforce out right now, our employers are going to be hurting in a way that they've not been hurt in a long, long time. This is the skin in the game that the employers have already, whether they realize it or not. They have people that if you're someplace that does cartage or manufacturing up here, you likely have some kind of point system for your employees. And if they point out on absences, they're gone. And these employees know this. They can do math. So if they see that they're about to point out and they don't have childcare, it's been my experience, they just leave. The employer never knows where they go, what happened to them. They just don't show up ever again. But they'll show up at somewhere else across town. If they're at one cartage place, they'll go to another one. As long as the economy's good, that's something you can do. But as I said, Joel pointed as if you're an employer, you've already got skin in this game. You're already paying for this one way or another.
Thank you. Thank you very much. Next, Carrie Redmond from the YMCA Early Learning Center. As a provider, what are the biggest needs, challenges, obstacles, and opportunities that you see with childcare?
Thank you. And I think, Joel, thank
Hold
you
it
for...
closer.
Closer. Can you hear me now?
Yeah.
Do you want me to put my
die
mouth on
again?
it?
I think it might have died.
I
again.
think it might have died. I'm just going to set it down. Is that okay with everybody? Can you hear me? I project well. I was a public school teacher for a long time. I think, and that's a part of this, right? I thank Joel and Randy for saying that, the childcare crisis is a pie. It's a lot of different pieces and parts in terms of why we are where we are. One is there's not many spaces for kids in childcare. So as we said, 1 in 10 children is waiting for a spot. Where are those kids? So when they go to kindergarten, what does kindergarten look like for that teacher? I was a preschool teacher for a long time, and what does that look like for us when they've never come to us? All those things they've learned, and they just go straight. Childcare too. We need those kids in our childcare programs. High cost of care. These are already things we talked about, but I just want to point that out. I mean, we're a middle of the road. We're the YMCA. It's where I work. I'm the YMCA Early Learning District Director. And I'd put us right in the middle of the costs in Findlay. And it would be, I would think about $14,000. That's the number I wrote down for a one-child family in our program, sort of middle of the road family in our program. That high cost of care is not sustaining. For in the nonprofit conversation, how does a child care program stay open when it costs so much to run. To run that program costs a lot of money, but yet I can't charge too much more. To the only money that I have coming in is tuition. I can't charge more than that $14,000 a year because I want families there and I don't want to raise the costs. In addition, we keep talking about this, it's the JFS conversation. Hey, hello, better? Okay. The JFS conversation. I believe strongly, I'm so thankful at the YMCA that it's mission driven, that we believe in publicly funded childcare. Publicly funded childcare is important to me. It's important to where I work. However, if they don't come, when Randy was talking about policies, if a child does not attend, we don't get paid. And that is scary. I want more publicly funded people to have publicly funded childcare is in their programs, but how am I supposed to push them to do that if they're not paid if the children don't come? We can talk about that more later. But that's a big part of this.
And can you talk about the growth at the YMCA over the past couple of years to address the childcare crisis, including the new Early Learning Center and the Center for Excellence?
Okay, if you haven't seen the new ELC, please come visit me. I'll take you on your private little tour. It's the most beautiful center. I'm part of the collaborative, very thankful to be part of this collaborative. And even prior to that, we knew there was a need. We knew that there was a need in Hancock County for more children to be in childcare. And we were at the Child Development Center, which was not an appropriate space for children. This served us well for many, many years, but now we're in a place that was designed specifically, thank you, Irvin, for children. And please come visit. I'd love to have you. 100 more spots for kids in care. So we addressed that need. Now we have more space for kids, but that is going fast. So I think having more people in childcare will be huge. The center, we have a dream. It's now not a dream. It's in fruition of something called the Center for Excellence. And we want to be the hub. If you come see this beautiful center, we have a piazza in the middle of the building where professional development can happen, and all my friends in the audience who are partners with me, and I can say, come teach our teachers and do this for us because this is what we need to do for them, and we can create high quality teachers who are amazing, and they are teachers. I believe strongly that we need to train them to be great. That's where we are. We're in a situation now where we see someone who we can come in the building and I see it in them and I can train them to be wonderful. And I'd like to be that place at the YMCA to help become excellent. So if you have any interest, I'll give you my card at the end of this to come help us with that. You have something else about the Center for Excellence, the new Early Learning Center. That might have been everything.
I think that was it. Thank you.
You're welcome.
Thank you. Kathy Stroll with the Village of Macomb. Mayor Stroll, what made you and other partners identify childcare as a priority to Macomb? And how did you go about pulling together a partnership to address it to ultimately open the Little Panthers Childcare Center?
That's a very loaded question, and I'll take the extra time. Macomb over the years had a very, very rich history of having several great in-home providers. Then we all know COVID hit, the world shut down, and many of those providers chose not to have children beyond that. Also on social media, we continued to see, hey, I'm looking for childcare. I'm not sure they were all looking for quality childcare. Through the console in 2023, we were looking at our strategic plan for the community, and childcare was at the very top. We wanted to have a daycare. We also had discussions within many of the community members. There were great-grandparents, grandparents who were helping to raise their grandchildren. They were looking for full-time daycare. They were looking for before school, after school, and some of them were even looking for some respite care. A couple community members were looking at the feasibility of locating a daycare. And through all of that, it appeared like we were all different strokes on a wheel, but not really moving forward and rolling along. And then it happened. Deb, I'm going to have you raise your hand back there. Through one single conversation, just by chance, following a Rotary meeting, Angela DeBosky, who at the time was the CEO for United Way in Hancock County, and Deb, who is a grandparent, great-grandparent, helping to raise some grandchildren, had a discussion following that Rotary meeting. Together, the two of them, I'm down to 30 seconds, the two of them called both professional team as well as the local core memberships together. And what was very unique about that meeting, the professionals came to little old Macomb. Grant writer, former one Lizzie from Hancock County Regional Planning, was at the table and mentioned that she had found $1 million leftover COVID funds that we could apply to get this grant rolling. The scramble was on big time. Community, we put surveys together, letters of support. The Community Foundation provided us with funding to have Irvin draft a rough design for our building. And lo and behold, the community received that $1 million grant. I thought we had hit the jackpot, we would have extra money. That was not true at all. It didn't go as far. We canvassed the community for more donations, and at that time I learned how to be a very good beggar, along with Jen, who approached the commissioners and begged for additional funding to get this off the ground. Although my background is in public education, the interest for the village to actually operate a day-to-day operation for a daycare center was not in the cards. So council, we met with 5 local providers, had those providers come in. Each one did a presentation for our council, and the council offered the lease to the building then to Keith and Lisa Alt, who operated Loving Daycare in Ottawa and more recently a center in Columbus Grove. And together the name, the Little Panthers Learning Center, was branded and has been a very welcome addition to Macomb community. We opened in August of 2024. We are currently full at capacity, serving 89 children with 18 employees.
Thank you, and congratulations to Macomb.
Yeah, thank you to everyone here. I saw a lot of familiar faces this evening. It was a full team effort.
So what additional challenges do you feel are faced in the rural community when it relates to childcare?
I thought about that question, Brian, and honestly, I think that there are some similarities in the city as in the rural. Currently, our daycare serves children from 6 surrounding counties: Seneca, Henry, Putnam, Wood, Wyandotte, and Hancock. Even though we're rural, many of the people traveling back and forth find that they can drop that child off better in a rural spot than fighting traffic in the city or being blocked by a train, as tonight Joel and I experienced that. Again, we have a full waiting list, which never thought that it would happen that quick. We are looking at ways to expand, whether that is an addition on the building, Irvin, the possibility of modulars, or some of the summer programs for the older students possibly using some space at the school. We still hear of many families still looking for daycare. It's the cost. I think a lot of our clientele are caught in the middle. Maybe not so much professional high income where we're at, and they're just above that threshold. And yet it's a choice between, do I try to make it at that job, or what do I do for childcare? Oh, there's a lady that has a trailer down here. Perhaps I'll drop my child off there. And again, back to the kindergarten readiness, they do not get that quality of learning there. One that I think is very important, especially for rural, is location, location, location. We had a number of choices that we were looking at when we were developing this center. We ended up on some property that the village owned, which was really adjacent almost to our park. The pool is used throughout the summer by the kiddos. We have a new community center going up right now and next to the Dollar General. So again, it's location. I will say this entire process and project was amazing. I learned so much, and I've also met some really, truly amazing people who deeply care for the children here in Hancock County.
Thank you. Thank you very much. Brittany Bills Darby with Ohio Logistics. We often talk about childcare being a workforce and economic development issue. How do you see the lack of affordable quality childcare impacting our local businesses?
So Findlay-Hancock County, I would consider a regional employment hub. We have a lot of industries in Hancock County, a heavy concentration in warehousing, distribution, logistics, and manufacturing. Not to take away from the other industries, but those industries specifically have a heavy hourly workforce, right? They require consistent staffing, multi-shift coverage, and a consistent or predictable attendance. So childcare that caters to that workforce, the families of those workforce is very limited. Affordability, right? That hourly workforce, as we spoke on earlier, their wages can range from $18 to $30 an hour. If weekly childcare for one child is $200 or $200 a week on top of their living expenses, that doesn't leave a lot of disposable income, and therefore they're faced with the decision of, do I stay home or do I go to work? Multi-shift coverage, right? A lot of our manufacturers are 24/5 or 24/7. There are not a lot of childcare options in the community that take children before 7 or that have second shift options or, therefore third shift options. So there really are a lot of challenges that our workforce encounters when it comes to childcare. I do consider childcare to be a core economic infrastructure. Businesses, parents, and our economies really feel the impact when childcare is absent or when there are gaps in childcare. Findlay's reliance on those industries that I spoke on, the region is greatly impacted, right? Childcare, it can be unaffordable, it can be unavailable, or it's misaligned with the working hours of childcare that is needed for those workforce families. So investments in childcare, whether that's expanded hours, employer partnerships, or community-based programs, I only think is going to help stabilize the workforce and boost our economic growth.
Thank you. I'm going to ask you to switch hats now. As a mother with small children, how is a lack of available childcare impacting you and other parents that you talk to?
My mother hat's never off, by the way. But yeah. We are a family of 5. My husband and I have 3 young children. So we have a 7-year-old, a 5-year-old, and a 2-year-old. And my husband and I both work full-time out of the home. I like to say that we are navigating 2 different stages of childcare. We have our youngest, who's 2, who goes to childcare full-time. And then we have our older 2 who are 5 and 7 who go to school full time, but that doesn't mean that childcare is off the table. I think sometimes childcare is just really up to pre-K and then, they're in school. No, it's just a different stage, which I'll talk about a little bit more here. But we are currently in the thick of it with our 3 children. In 2023, I only had 2 children at the time, and our 2 children were going to an in-home care. Our sitter came to us and said she was no longer going to watch children. She was going to get back into the workforce, go back to her previous employer. And with that, she gave the families a 30-day notice. So 30-day notice, I have 2 children. And then another curveball, I was pregnant with our 3rd child, and I was 6.5 months pregnant. So our world was turned upside down. We had to scramble to find another solution. I not only have to find 1 seat at a daycare center, but I have to find 3. Who has 3 seats open for an entire family? If you've ever navigated that, it's extremely challenging. We feel fortunate that we were able to secure seats within a child care provider's home rather quickly, but that's not without the blessings that we have being our support system, our flexibility. and our strong connections that we have within the community. You know, it really opened our eyes to those families that do not have those same support systems, the same income, and the same connections. It really was a struggle. So one of the first pieces of advice that we give new families is to secure your childcare. And, you know, most think, oh, I've got 8 months to figure that out. No, you don't. Childcare is limited, wait lists are long, and they fill up extremely quickly. And then it doesn't stop there. You know, once you secure your spot, you still have challenges. Children get sick, school gets canceled, your work day, your plans, it all goes to shambles, right? And they don't end. Challenges just change with the new stage of life. Right now I'm going through, I will be experiencing my first summer where what am I going to do with my school-age kids, right? We work full-time. What are my options? Obtain a nanny, right? Go to camps. All of those have limitations, cost, affordability, and the logistics to get them to and from. So it's just a different stage with new challenges. We're very blessed with our children, right? They're our greatest blessing. But the stress, the guilt, and the constant challenges that you face are very, very real. So in a community like ours where childcare choices are limited, wait lists are long, it is a true obstacle that families face on a day-to-day basis. It weighs heavily on families, it weighs heavily on our family. So communities really do. We need more reliable, affordable, and dependable childcare options to support them.
Thank you very much. A quick reminder, we are going to ask for questions in about 5 minutes. So if you haven't written down your questions, get them ready now. Christina Mern from the City of Findlay. Mayor Mern, what are you hearing from other mayors and leaders across the state and country related to childcare and that we can learn from?
So I would love to say that I have found the solution from speaking with other communities, but really the reality is that everybody is jealous of how we are working. And I know sometimes people are like, oh, you guys just say that because you want to toot your own horn. No, literally, I spoke a couple of months ago at a presentation on workforce, and they were talking about childcare. The mayor of Pensacola is a friend. He was running the panel and asked me to speak about it. He then called me and said, can you please send me your materials? A couple of days later, he then presented at another event, and the mayor of Los Angeles reached out and said, hey, can you send me that information? He said, yes, but I actually got it from Christina. You might want to reach out to her. And so we showed kind of here's how we're collaborating through the collaborative, here's how we're structuring. And I think that the really big thing that, I got to remind us is we're moving in a really good direction. This is obviously a huge issue. And so when we had that first kind of strategic plan meeting, one of the things that we walked away after, you have 2 or 3 meetings, we said, how do we break this down into actionable steps? And so that's really what the last year that we've been focusing on and trying to identify some of the policy changes that need to be implemented to be able to make progress. It's great that we have Macomb having opened, the YMCA expanding, we have Carol's spot opening, we have all the First Pres looking at expansion. All of those things are meaningful progress. And so I think the thing that I've learned is that we're moving in the right direction. And I have a lot of hope in that, while recognizing it's also going to continue to take a lot of work with us all rowing in the same direction.
Thank you. Let's talk about one of those specific ideas. From a local government perspective, what are the benefits of the TriShare program in Hancock County?
Yeah, I think the TriShare model is going to be so important, not only just from the support that it obviously provides to the families, but I think it really does open businesses' eyes to kind of the burden and struggle of childcare. I think there's a lot of folks in our business community, Brittany's obviously not one of them, that they haven't been in it for a while. They maybe don't see the challenges of it, but they're seeing the backside implications with their employers. And I think, too often we get in this position where people aren't willing to have that honest conversation of like, listen, yeah, I've missed work. It's because my kid is sick or because my daycare is unreliable or yeah, I really just can't continue to afford this. So I think it really is opening people's eyes to it. And I'm glad that the state offered this model, but they're also continuing to evolve and learn. And how do we continue to tweak this? Because it is, I think we need to make sure that we have a sustainable long-term model that builds off of this.
Thank you. I think there was a survey a couple of years ago, and a business survey, and over 80% of those businesses surveyed reported a lack of childcare, whether it be affordable or available childcare, negatively impacted their operations in the past 12 months. So it's over 80% of local businesses are feeling that.
Yeah, and just one point as I was going down the line, listening to everybody else, is I just want to remind everybody, one thing that I've been talking when I'm going out is reminding folks it takes a village, right? Like literally, it takes all of us in this room. Now, many of you are providers, but individuals like my mom, who is retired, she teaches piano in the evenings, and her main goal is she just wants to be a grandmother, going and taking care of my sister's kids when she has the ability. But I've also encouraged her, like, Mom, talk to other families on your street so that they know if they need you in an emergency, like that you're there for them. Whether it's like, hey, I can't be there when my kid gets off the bus. Can they sit and do their homework with you for 2 hours? Culturally, we have shifted away from that. And I think that if we also just make those small moves to make sure that other people know that they have that backup support in days when you may not have it, I think that also goes a really long way. So I challenge all of you to find a way to do that.
What other steps do you see yourself or the City of Findlay government taking to support childcare in Findlay over the next 1 to 5 years?
Yeah, so from a personal standpoint, is just, again, trying to educate and pull together the resources. A lot of what I do as mayor is keeping my eyes open and saying, how do we pull these together? In that same vein, I see that a city government also looking for opportunities when we've been making meaningful progress on transit, on housing, on workforce. How do we now turn and say, okay, hey, providers, what is your challenge? What is your vision? So that's another piece of homework you didn't know you were going to get from me, is like, make sure that we are informed. Like, send me an email once a year on, hey, if you see a grant that helps with this, hey, if the city can help with infrastructure funds, this is what we would need. Being aware of those puts us into a position to keep our eyes open for things. And when there are those last minute opportunities, to be able to reach out to you. I don't just have an endless pot of money. I wish I did. That would make life so much easier. But we don't. But knowing kind of what the different opportunities are for providers, I also think that we will probably be pushing out some communication just for me about reminding those home providers on what the regulations are, because you can do a lot just providing care to 2 or 3 kids. If that's 2 or 3 families that have that additional income and are being able to be in a more stable situation, that really goes a long way. So I think we're going to focus on doing some of that as well.
Excellent. Thank you. So it's your turn. Some foundation staff members will be working their way through the middle. If you could pass your questions to the center, and then we will ask them. As long as there's more than one question to start, it won't be awkward. We won't all know who wrote it. And we will do one more pass through, so if this spawns a question in your mind, I'll mix them a little bit. Have corporations in our area ever considered opening or offering childcare within their facilities? As an example, a local warehouse having childcare facilities on site.
So I can start because I know Brittany's been involved. Yes, that has been discussed multiple times. I don't think the hospital would mind me mentioning that, at one point they were talking about it. The reality is the demands to get one stood up, the operations, and that's not their expertise. It made more sense for us to try to focus expansion of existing resources to get better economies of scale than trying to stand up more locations. And so that's what you've really seen the last 5 years. And I think you'll continue to see is using the efficiency of one spot to be able to add more. But I do think, going back to Brittany's comment earlier, the shift changes and the expanded hours is still something that we need to address. You guys want to, Brandy?
Yeah.
Just yell.
Okay, I will. I don't encourage I have not encouraged, I will not encourage employers to get in the business of opening daycares. They are themselves a business with a lot of regulation. One of the things I'm going to promote the tri-share model, of course, that the Community Foundation has. But another option is make a partnership with a daycare center. I would also encourage employers to look at whether or not it could be a benefit, like health insurance. I don't know that that's the case. There is some federal tax law around that, but I am not a federal tax attorney. I stay away from taxes as best I can. But if that's something I think you could look at, but I would not encourage a business to try to get into the daycare field.
Can I say something?
Yeah.
And I'll add to that. That's part of the reason why I'm in this position. I was brought to the YMCA because there was a high need for childcare, and Findlay City Schools had a program and needed a program to be changed. And so we took over FABS and now have YABS. Corey Rawson wanted to put a childcare center within their building. So we went there and helped them get that started up, and now we run it. As he said, that's sort of our business. That's what we do. So, and part of the Center for Excellence dream is to help providers, and chat with them and say, hey, we have some ideas to be able to help you. We can be a resource to help you start up a new childcare center. So we want to be there for people to help with all of that. That's sort of what the Y does.
Carrie, keep the microphone for this next question. I think that's not ominous at all.
You said you'd be real nice.
What about the lack of qualified early education teachers? Without more teachers in the field, there can't be more centers.
No, it's true. And I keep forgetting to say when this whole thing came up, I have lost some real good friends. No, that's sort of what Joe was saying. I have some great friends who are no longer in the business of child care because they couldn't keep their business open. And that's sad. And part of the reason is because of high quality childcare. My friends who are in the audience tonight have high quality childcares or have work in high quality education, and we have high standards. I have not changed those standards. Those standards are still here, but I have changed the way I view how we get people there. And I think, for us at the Wire, as an example, if I see, and I told you all those already, if I see the right person come in, maybe it's someone's grandma or mom who I know would be really great, and maybe I can help her get to become that, then we've sort of had to change our view. It has changed over the years. It just has. We need more people who want to choose this as a career, and it might take a lot of time, but I have a vision to try to help with all of that. So, yeah. Hopefully that answered whoever's question that was. But in terms of people coming in with bachelor's degrees, it's a hard, that's a hard fight to get them sometimes. It has to be the right person. That's difficult. Yeah.
There's a teacher shortage in our, not just in our area, but nationally, which is also leading into this. There's an administrator shortage, a teacher shortage, and all of this plays in together, and it doesn't take us too long to think about why there's a teacher shortage and fewer people moving into education when you look at how challenging it is for teachers and educators right now.
Oh, and I have to say one more thing, because you just said that. It's a hard job. You have to love it. You have to want to do it as life's mission and work. It's because none of us are in it for the big bucks. We are there because we actually want to make an impact. Okay. Oh, yeah.
How do we address the on-call need? For examples, need for childcare when school is delayed, teacher conference days where there's no school, holidays, spring break, etc.
Okay, I'll talk. And I'd add those who work third shift and those who work second shift. And I mean, I don't have an answer. Didn't you say there's no real answer? I don't think there is an answer. I think we just keep doing what we're doing. I think that the collaborative, we're seeing all of those kinds of things and figuring out ways to sort of help all of it. But Randy, you have more to add? Yeah.
The more centers that you can have, or providers, and the more that those people can earn a living doing that, the more competition you can have to have, hey, I can find a niche in third shift work. I can find a niche in a second shift operation. And the more slots we have in Hancock County, the more likely it is that someone can step in on one of those occasions where teachers are off for, what do you call it? The enrichment day, or kids are sick. But when you're looking at 10 kids for every slot, there's no way to do that. I have 54 kids that are eligible for publicly funded childcare, and there's no slots for them, and it's usually closer to 70.
One thing I would add when we talk about like school being canceled and the parents still need to go to work, I guess it's my theme of the day is, we need those relationships, right? Like the neighbor across the street, or my aunt. Like I was fortunate, my mom was stay at home, but that meant my aunt dropped her kids off right on the way to work for snow days. So I think we have to just make sure, if how you can build those networks to be a support system. And we should probably do better at looking at the calendar and trying to have, community events or different types of childcare options those days. I'll put challenge out to everybody because that's not my wheelhouse, but.
We'll let Tasha and Kimberly take one more pass through. I have one more loaded question that I want to say for the end.
He is very ominous, isn't he?
I want to sit in the front to watch this one because.
Oh boy.
All right, here we go. How do we reduce the cost of childcare to make it economically feasible for more families while also keeping childcare economically feasible for childcare providers?
Oh, I want to say. I will say we had a study was done. I think Groundwork did this, trying to figure out what the true cost of care was. Like, what are we really? I have in our building, they have 300 kids. We are also part of a nonprofit. I also have multiple sites. That's how we are able to make it. But someone who has 60 kids, that's more of a difficult thing. But the true cost of care for an infant care, when you want to have high quality care, 3 or 4 children per teacher, now what Ohio requires, which is 5 to 1. When you want to have high quality, that's expensive. So how do we do it? I don't know. We need support. That's how we do it. We need lots of support, community support, business support, tri-share models. All the things need to happen. Anyone else have something they want to say? Yeah.
Of course you know I do.
Yeah.
I can't help myself.
Yeah.
As the Ron Swanson of county government, as I call myself, it goes back to what I said earlier. We're going to have make some decisions about what high quality childcare means and looks like. Do our people that provide childcare need to have a teaching certificate and compete with high schools or any, the public school system? No provider is going to be able to provide STRS retirement plan. No provider is going to be able to provide medical, that high quality medical insurance. And as of 2 years ago, the last budget, high school teachers are required to be paid at least $35,000 a year. Now, that's kind of disgusting. We had to pass a law, in my opinion, for that, but that's where we are, and that's who the daycare centers and providers have to compete with. So I've been kind of the person that has said for a long time, I don't know what high quality childcare should look like. I do know when we didn't necessarily talk about high quality childcare, but we talked about it as a workforce support, we had a lot more providers. And we did not have as much regulation. Now, do I want kids to burn down in buildings and, have bad things happen to them? No, I don't. But we've got to be somewhat thoughtful about how we introduce regulation. And every time something bad happens is not necessarily an opportunity to have a law passed with a kid's name attached to it.
I completely agree with what they both said.
All right. We will have time after with all of our panelists staying up here if you'd like to one-on-one ask some questions. But I want to thank you for your thoughtful questions and making space to learn more about childcare in our community. As we said at the beginning of tonight's event, childcare is a complex system. It will take all of us, nonprofits, for-profits, private government entities, public partners to come together to make a lasting change in this really important area of our community. That said, the Community Foundation wants to make supporting childcare as easy as possible. So we have established 2 different options, one long-term and one short-term. The Community Child Care Fund is an endowed field of interest fund, meaning that it's invested and will continue to grow while distributing a portion each year for our community's childcare needs. nonprofits will be able to submit grant requests for these funds quarterly. The short-term, non-endowed option is the Hancock County Tri-Shared Childcare Fund, which will support participating Hancock County childcare locations for low-income families who do not qualify for publicly funded childcare through subsidies. And we've heard quite a bit about that this evening. The foundation is setting the bar for these funds. We have committed $50,000 to the Endowed Community Child Care Fund and $100,000 to the Tri-Share Fund. Our challenge to each of you, our community, is to join us in this investment. By supporting these funds and others that exist, you too can help ensure that the children in our community have the care that they need. At the back of the room, Kimberly and Jenna, if you could raise your hands, you can find more information on these funds. You can have one-pagers on the state of childcare in our community. We have information on the Tri-Share Fund, and we also have on the screen right now the QR code for the State of Work and Play report. We have a couple of physical copies in the back. Please share the State of Work and Play with all your friends and neighbors. Also, follow us on social media on both Facebook and LinkedIn. During the campaign, we are sharing information about each of these 8 areas. So right now, if you look at our more recent past, you will see us sharing information about childcare and the current state of childcare. And we have been so fortunate to be trusted as members of our community have come forward to share their stories when it comes to childcare and how childcare has impacted them. And we thank them for doing that. Thank you for coming. The weather did not cooperate necessarily. A train blocked a third of you from getting here, and we were getting frantic messages. But you chose to be here, and you chose to be here to learn together about childcare and what we can do moving forward. And for that, we thank you. Please join us as we continue this important work and travel safely to your next destination. Thank you.